My name is Ron Hugate. I'm a board-certified orthopedic surgeon at Panorama Orthopedics Spine Center. There's a long tradition of cars in my family, specifically Mustangs. You know, if you work hard, you have to play hard, and this is one of the things that I do in my off time. It's a modified motor. It's a Roush Yates modified 302. I really like to work with my hands. I have a mechanical mind. The combination of mechanical, skeletal issues and working with my hands is sort of what led me to get into orthopedics. Played a lot of sports in high school, junior high, and then recreationally in college. I went to Virginia Tech. There I majored in mechanical engineering. I had an injury to my knee while playing basketball, and it sort of thrust me into the world of orthopedics and orthopedic surgery. It turns out that my surgeon was actually an orthopedic surgeon who was a previous mechanical engineer as well. So I was really interested and intrigued by the idea that you could become a surgeon and a doctor after going through engineering training. And so I looked more into that and decided to move on to medical school after undergraduate. During medical school, I decided to join the Army Reserves. Between the years 2003 and 2010, I was deployed 4 times to Afghanistan and to Iraq. This was part of a hospital called a combat surgical hospital, similar to a MASH that you may have seen in the older television series. Of course, saw some terrible things there, lots of extremity injuries there, mostly from blast wounds and high velocity gunshot wounds and things like that. So I spent a lot of time there taking care of traumatic amputees. You know, really heartbreaking to see a young, healthy person who feels that they're immortal and indestructible to suffer a traumatic amputation. It's not something you forget easily. After going through that, I don't get rattled by an awful lot. You know, you want your surgeon to have the slowest heart rate in the room, always, and I think I'm that kind of a surgeon. I really wanted to take care of people that had big problems. To me, the bigger the problem that someone has, the more I'm able to help them and kind of get them through a tough time in life. And so I tended to gravitate towards more complex orthopedics. In 2003, I decided to take a fellowship, which is additional training after residency, at the Mayo Clinic for 2 years studying bone and joint tumors. There are a number of cancers and tumors in general that affect the skeletal system and can affect the strength of your bone or can even be life-threatening. Since my training, I've continued on with more complex type orthopedic cases. It may sound corny, but I really like to help people. That's why I went into this, and that's why I do what I do.